The SGR fix is one step closer to reality. Welcome to the August 5th edition of Policy and Practice, the weekly podcast from IM&G Medical Media. I'm Terry Rudd.
And I'm Mary Ellen Schneider. Health exchanges are set to open in less than 60 days. Some lawmakers want to move to a Medicare for All system, and the Sunshine Act requirements are in effect. But first, the bill to replace the sustainable growth rate formula is moving along in the House. In a display of bipartisanship, the House Energy and Commerce Committee voted 51-0 to approve a bill that would replace the physician payment formula. Lawmakers drew on ideas from physician leaders to craft the proposal. If enacted, the legislation would give doctors a 0.5% raise for the next 5 years. That would give them time to drop a new payment system. Organized Medicine supports the bill, even though they have misgivings about some provisions. It's the first time in a decade that a serious SGR fix has gotten this far in Congress. Committee Chairman Fred Upton, a Michigan Republican, said he's certain it will become law.
In harnessing the ideas of the medical profession and working as a team with Energy and Commerce Democrats, as well as Ways and Means Republicans and Democrats, we've crafted a policy that will not only get out of committee, but clearly has the merits to make it to the president's desk.
But before it gets there, Congress has to figure out how to pay for it.
Elsewhere on Capitol Hill, partisanship was on full display. In a set of hearings in the House, GOP lawmakers hammered the administration over problems in the implementation of the Affordable Care Act. With less than 60 days to go until open enrollment in the health exchanges, Medicare Administrator Marilyn Tavenner said the agency is on track, but Republican lawmakers greeted her testimony with skepticism, saying they remain concerned about premium hikes and employers who are cutting back on their workers' hours because of the law. Ms. Tavenner testified that premiums are actually falling. Democrats accused their GOP colleagues of working to sabotage the law.
And on the 48th anniversary of the passage of Medicare, some liberal lawmakers were pushing a single-payer bill that would expand the Medicare program to all Americans. Vermont's independent Senator Bernie Sanders said the bill would ensure that no one is left without coverage, and it would reduce wasteful spending.
Why are we spending 30% of every healthcare dollar on administration and bureaucracy? We should be putting that money into doctors, into nurses, into disease prevention, into keeping our people healthy.
Meanwhile, August 1st marked the first day that drug and device manufacturers must begin tracking and reporting to the government payments they make to doctors. Under a provision in the ACA originally called the Sunshine Act, information on the payments will be made public in September 2014. Physicians aren't required to report, but the American Medical Association is advising them to keep their own records just in case. Medicare officials recently released a free smartphone app to help do just that. It's called the Open Payments for Physicians app, and it's available on iTunes and Google Play.
Well, it's August, and Congress is out on recess until after Labor Day. Look for the next installment of our podcast on September 3rd. But if news breaks before then, we'll bring it to you. And that's the Policy and Practice podcast. I'm Mary Ellen Schneider.
And I'm Terry Rudd.